During the rollout of the then still in clinical trial COVID-19 vaccines, Ontario's own public health IT systems were being built by people who saw red flags up close. Today, we hear from a privacy impact assessment specialist who was inside of this machine, tasked with building the provincial vaccine database. What she witnessed wasn't just bureaucratic sloppiness, it was a systemic skirting of informed consent, especially for children, paired with deliberate blind spots on safety data. When she spoke up, the system turned on her, and she's joining me anonymously now to share her story.
The Ontario government should have either known, or if they hadn't considered, that they needed to start considering what was happening at a global level and not just in Ontario, and understand that there was a level of suppression of information that was happening at the same time, and that there were children that were being affected because we were in a live clinical trial, and that there was no way for us to be able to know what the long-term side effects for these children were going to be. Building out a privacy program in hospitals, we began looking at research ethics boards proposals. You're looking at clinical trials that are happening within organizations. And we started understanding, very standard processes when the requests are coming into the hospitals as to what's involved. So if a clinical trial is going to be launched, you're going to look for a pilot, but they want to try a new process. They're looking for consent. So we would be reviewing those data access requests on behalf of the organization. That's when I was contacted by a recruitment firm that was working on behalf of the ministry, that was looking for a privacy impact assessment specialist on a Ontario Public Health Services cluster support system. So it would be an IT service being used by Public Health Ontario to facilitate the documentation of the vaccine that were being administered in Ontario.
She understood the rules. Informed consent wasn't optional legalese. It was the only legal shield that could transfer risk away from the state during a time when the province was not only mandating a novel shot, but taking direct ownership of vaccine data for the very first time.
Within the Ministry of Health, the IT portion of the vaccine database and the case and contract management database were managed under the Health Services I&IT cluster within the Ontario Public Service. Contracts with the ministry, this is the first time from a data collection standpoint that the province was owning the information. The system was owned and managed by the province versus the healthcare practitioner. What they did through contracts was then the vaccinators signed contracts to become and gain access to the system to document vaccines and vaccinations. When we were along the way, we were using our healthcare experience to be able to look at the informed consent model, noting along the way, though, that Public Health Ontario is under the Healthcare and Promotions Act, which also has liability implications.
No robust consent safeguards existed for the 12 to 17-year-old rollout. Officials simply declared that kids could consent, despite no family doctor familiar with their history, random vaccinators in mass school clinics, and massive pop-up events at places like Nathan Phillips Square in Toronto that branded children as superheroes, enticing them with stickers, selfie stations, coloring sheets, and animal footprints to get their shots. One grade 10 student told the Toronto Star she got the shot to finally see her friends, family, and hopefully go to school. That wasn't an informed choice for her health. It was social pressure sold as empowerment. At this same time, international safety signals such as Israel's early detection of myocarditis clusters in young males, especially after the second dose, and Taiwan's flagging of 23 cases in 12 to 17-year-olds shortly after Pfizer rollout were already flashing red. Against this backdrop, the data-minded specialist sent the following escalation email.
If CMOH is liable for risk in the administration of the COVID-19 vaccines, namely Moderna, Pfizer, or AZ, if the Ontario government is the one that is accountable for the efficiency and any adverse side effects, then a documented informed consent will protect the Ontario government from lawsuits because we, CMOH or MOH, Ontario government, are advising setting up these mass vaccination events through public health units. The documented consent, especially in the way of the 5 to 11-year-old side effects, death, custody, allergy, exemption issues, this technology is the only mechanism to provide a waiver for risk, especially in children. And I said that unless it's the IT cluster's opinion that it's the public health units or the agents or the health information custodians' clinical risk, when it's PHO or Public Health Ontario and the Ministry of Health promoting the vaccine, I said each jurisdiction will be held liable if a knowledgeable informed consent wasn't obtained and we can prove it. So otherwise, that this is an unconsented clinical trial which has been brought to various Supreme Courts and is unethical and is a human rights issue. The technology is the only way for the provincial government as a whole could waiver or sign off on the risk, ensuring the understanding of what I thought at that time was the first ever clinical trial for Pfizer, the only Canadian approved, because there was still ongoing the ongoing clinical trial in the United States. We weren't even past a 5-year mark to be able to understand what a population health consequence was going to be. I let them know at that point that I'll follow up with them tomorrow to confirm the amount of 5 to 11-year-olds that have died, pediatric stroke. I had been noticing that they were implementing protocols in hospitals, and that was new. I had been doing implementation of orientations in the healthcare setting since 2011. I watched orientation. I had watched what these processes looked like in a hospital.
She put this in writing. This was for the 5 to 11-year-olds. She warned the province could be on the hook for billions without proper threat risk assessment and consent documentation.
Initial response asked me, said they were confused, asked me who that I felt I needed to report them to in the way of programs that I understood that I seem to disagree with the nuances of the authority model underpinning the provincial COVID immunization schedule, but that I was reminded that my role was to provide privacy advice as requested to support the technology components enabling the program, not to opine aspects outside of this lane. And again, I was reminded who my direct superior that I was reporting to was, and that she had not requested me to provide privacy advice on any technology components in regards to side effects. That was the initial response that I'd received. And at that point, I couldn't let it go. At that point, I had seen too much, I had heard too much, and I wanted to ensure that any message that I had sent after that point would be escalated, could be documented. The last email that I sent, I felt, was documenting a point in time where the Ontario government should have either known, or if they hadn't considered, that they needed to start considering what was happening at a global level and not just in Ontario, and understand that there was a level of suppression of information that was happening at the same time, and that there were children that were being affected because we were in a live clinical trial, and that there was no way for us to be able to know what the long-term side effects for these children were going to be. It sat on me, and it has continued to sit on me for 4 years.
Initially raised on a stakeholder call that adverse event reporting was inadequate, short lists, no proper drop-downs, clean data rhetoric that didn't deliver usable fields, and this privacy assessor was told that was inappropriate and had her contract terminated immediately.
The response was termination of my contract. Response was termination of my contract through the recruiter, not even directly through me. I think once they told me to stay in my lane, once they told me that they had no interest in me providing advice, I asked them who. There was a couple more emails that I asked them, if not us, then who is looking at it from a clinical risk perspective. I think that was kind of the message that I was receiving, is that it was not within our mandate to be providing advice around the clinical risk of the vaccine. And I was looking at it from a documentation standpoint in working for the provincial government on behalf of the Ontario public, was that the balance needed to be there. After that, I went to the Integrity Commissioner's Office of Ontario and I did an intake there. But again, if you're the public and if you're not working within that systems and you were not aware of the level of suppression that was happening on Meta, that was happening even on X at the time, Twitter, Facebook, Instagram, if you weren't aware that all that filtering was happening, you had no idea. The people that were getting hurt, the Facebook support groups of people that were just reporting their own side effects that were being taken offline. Like all of that was happening. And I understood that the people that were within the ministry may not have been receiving the same messages as well. So I knew that if I said enough, if the risk and the threat was high enough, that the email should go high enough. And so I hoped that at that point that it would move to someone's office that might consider that this is something that we should be looking at the background. But all I noted after that was different repositories of publicly available information that seemed to be avoiding the one question that everyone was asking.
She was told someone would come pick up her laptop within the hour after she was terminated and then blacklisted, despite a just signed contract extension. She was threatened not only with civil action, but criminal charges too over a government laptop they withheld pay on. And that one question many were asking was about the risk-benefit profile of these shots. You may recall this disturbing response from Health Canada's Biologic and Radiopharmaceutical Drugs Directorate Division called BRDD. A doctor that I had previously interviewed flagged those risk-benefit concerns to the agency, who responded that Health Canada did a qualitative risk-benefit calculation at the population and public health level, as it would not be sufficiently accurate to quantitatively calculate risk based on their limited understanding of the virus and the disease. Basically, social acceptability and feelings drove the decision, not empirical data, research, or metrics. They spout common misinformation at the time. The benefits of the Pfizer-BioNTech COVID-19 vaccine are supported by clinical trial evidence that showed 100% efficacy in adolescents aged 12 to 15 against confirmed COVID-19 illness, while reiterating the qualitative evidence collected. NACI also reviewed available evidence on the burden of illness in this population and vaccine acceptability of parents and guardians. Suffice to say that she went to the Integrity Commissioner, but nothing happened.
There was a period of time after I sent that email that I didn't know what to believe. Because the response was so severe, like that there wasn't a conversation, that there was no potential remediation of risk, that there wasn't any interesting conversation about what that might look like, and from the outside there was no change. So there was a good period of time that I needed to sit with myself and be like, what did I do? Am I the issue? And as it took me years to come back to be able to read those emails myself and read what I read at the time that I sent it, to say that in every way, shape, or form, I actually believe it more than what I did the day that I sent it. You know, where the world continued to go, where the data has come out, I would feel more confident saying it today than I did when I said it then.
Exactly. And to tie this in with cases like young Sean Hartman, a healthy 17-year-old who simply wanted to return to his beloved sport of hockey during indiscriminate vaccine mandates for sports participation following a year of rolling social isolation by government decree, he was found dead 33 days after his first Pfizer dose. Courts have said that the state owed him no duty of care, and to others just like him. But these emails show the state knew the consent and safety architecture was broken and chose silence and suppression over mitigation.
Even now, all you're seeing is how every organization involved in the distribution, management, and administration of this vaccine, everyone turns their head as to that they're not liable. And so at some point, these individuals are members of the population within different regions. And I don't understand how the government promoting it the government mandating it, the government, right? How you can remove accountability from every level of the program that distributed it. Sean Hartman's was one that stood out to me. It literally came up while I was working at PHO. I thought to myself at the same time that we had done a package of privacy impact assessments. Again, being told we were never looking at clinical risk, but we were looking at informed consent. And there were mechanisms that if we did, the same way as, like I said, we mentioned there's lots of medications that have side effects. And we take those risks, we balance, and we make the decisions for as at an individual level. And I feel like if that long list of known side effects was given, then you could have at least said that the individuals were aware of what the consequences could be. And I don't know that people would have signed up for the same risk if they understood that these were known.
This wasn't one rogue employee. It was a system that prioritized rapid rollout over transparency and accountability. Ontario had the tools to strengthen surveillance and informed consent, but chose not to use them at scale. 5 years later, there have been no full public reckonings. Ontario and Canada owe the public an independent review of the vaccine program's safety and ethical framework. Anything less is basically an admission that protecting the narrative mattered more than protecting children, the same ones internal emails showed they had no idea how to compensate when injured. We'll keep bringing these voices forward until accountability is no longer optional. And until then, please consider supporting this journalism and signing our petition at nomoreshots.ca. For Rebel News, I'm Tamara Ugolini.